Tonight we continue our series on the opioid epidemic with a look at where the pharmaceutical industry fits in. Correspondent Doug McKelway tells us it's a simple path, really. You just have to follow the money.
When a coal mine exploded here in 1951, killing 11 miners, Kermit, West Virginia suffered its worst disaster. Since then, a new disaster, quiet and unseen, has ruined more lives here. Now spreading across the country, America is only now beginning to address it. This pharmacy, under a previous proprietor and a previous name then called the Save Right Pharmacy, could arguably be considered ground zero in America's prescription opioid epidemic. From June to September of 2006, the pharmacist here, James Woolley, ran what prosecutors call a pill factory, raking in as much as $20,000 in cash every day, which may have led to the heroin epidemic here in West Virginia, in Ohio, in Kentucky, and virtually across Appalachia.
There was such an abundance of cash that they could not close the cash register drawer.
Attorney James Cagle calls himself the father of the West Virginia opioid lawsuit industry, with over 100 suits settled, 30 others ongoing. The Save Right Pharmacy case was his first. He hired a private detective to shoot this undercover video. It helped reveal how drug manufacturers, distributors, doctors, pharmacists, and patients all helped play a role in the prescription opioid epidemic. While much of it was fueled by greed, at the root of it all is addiction.
This is the day that I was given my life back. It's the day I went to jail.
Chelsea Carter popped her first painkiller at 12 and was shooting up OxyContin by 16. Faint scars on her wrists still show the needle marks 9 years after she turned her life around and became an addiction counselor. She describes the euphoric sensation that opioids like OxyContin induce.
Your body just gets a warm sensation that makes everything in the world so much better, even though you don't realize that you're destroying everything in your life.
And the withdrawal?
You lay in bed and you shake and you feel like you could cut your legs off or your arms off, and it would just feel better than having to lay there and feel the pain.
A patient's pathological need to end that pain is what some unethical doctors and pharmacists took advantage of.
The doctor's office would have assistants who literally did a pro forma interview or quote-unquote evaluation of the patient and just ran them through it, and then would fax the prescription or even just the name of the person in some instances to the selected pharmacy.
The prescription almost always would be for 30 pills or more. Any less and the patient might not get addicted. Doctors would receive a financial cut for every prescription sold by the pharmacist.
It was first visit $350, follow-up visits $175.
This dynamic played out in pharmacies far beyond West Virginia.
The reality is that there have been pill mills that have popped up in different areas of the country, and these are operations where cash only, no prescription required.
As nationwide delivery of opioid prescriptions skyrocketed through the first part of the 21st century, the Drug Enforcement Agency, which is tasked with tracking prescription sales, raised almost no red flags.
In 1993, your agency approved the production of this opioid narcotic to the tune of 3.5 tons. 3.5 tons of opioids. By the year 2015, that number was up to 150 tons of opioids.
Prescription distribution records show one town in rural West Virginia became one of the busiest distribution endpoints for opioids in the country, far surpassing many major cities. Yet it raised no apparent DEA suspicion. The end result? 3 major distributors of prescription opiates, McKesson, Cardinal Health, and AmerisourceBergen, made $17 billion, sending 423 million opioid painkillers to West Virginia between 2007 and 2012. The damage now done, all parties are reassessing their approach. Doctors and pharmacists are being told to limit pill numbers.
Allow pharmacists to dispense only what you need, rather than having people have the opportunity to stockpile opioids.
Manufacturers are formulating abuse-resistant opioids that can't be crushed into powder or liquefied. Federal authorities are tracking wholesale distribution better and are enforcing criminal penalties. And one effective deterrent to opioid abuse continues unabated. Just the last week in March, 3 more lawsuits were filed against drug distributors, accusing them of flooding the state of West Virginia with highly addictive prescription pain medications. The suits seek damages for treatment, prevention, and hospitalizations. They don't even mention the untold number of deaths which have occurred here. Brett?
Amazing. Doug McKelway in West Virginia. Doug, thank you. One expert saying we're erasing, essentially, a whole generation in Middle America. Tomorrow, Kristen Fisher takes a look at the economic fallout of the opioid epidemic as our series continues.